Well, thanks to all the speakers joining us. I know we have a small live stream viewing too that we're sent to select participants. So I just checked in with our IT department, and we have a lot of participants from different parts of the world. So thank you for those that are joining us early morning, and also for those late evening. Especially, I know we have the representative from JICA, which will be speaking later, and also from Finland that have joined us at a late hour. I think the fact that so many participants and audience members have come in from so many time zones really speaks to the momentum that is growing behind the idea of having these sorts of conversations about innovative partnerships, such as the ones that, Gilead and also MasterCard are working on. I know that as I speak, to the common vision that's being brought together here to find innovative and sustainable approaches to address both health, digital, and financial inclusion in the emerging markets, it's evident more than ever that this is needed under COVID-19. So with that, I'd like to turn it over to Mr. Clifford Samuel to give some opening remarks, followed by Mike. And Mr. Clifford Samuel is Senior Vice President of Global Patient Solutions at Gilead Sciences. Clifford, over to you.
Thank you, Joanne. It's a pleasure to be here. Thanks for all who joined this session. At Gilead, we believe our medicines, our life-saving medicines that we develop, we research, develop, and commercialize, focused on areas of unmet medical needs. So HIV, AIDS, viral hepatitis B treatments. With HIV, AIDS, we can now prevent HIV infections, new HIV infections. We have a treatment that prevents HIV infection. We treat HIV infections. We can treat hepatitis B. We can cure now hepatitis C. And one of the things that we make sure with the program I run is that these medicines, these treatments and cures are accessible to those who need them at the base of the economic pyramid. That's really important. Today, right now, about 15 million people wake up each day and take some version of our HIV medicines. Much of that is through a novel, innovative approach where we do a technology transfer of our licensed medicines, our FDA-approved medicines, to Indian generic manufacturers so that they can have access to these medicines. They can develop generic versions and make these medicines available to ministries of health in emerging economies, poor developing markets as well. One of the things that we've seen is that with COVID-19, that has really transformed or brought to light the need for something that we've seen as we are advancing our treatments for HIV, AIDS, and other cures for like hepatitis C. We see that with international donor aid, philanthropies, and governments, all of the funding is concentrated into 3 diseases: HIV, TB, malaria. And so you can treat someone with HIV for 10 years, and then on the 11th or 12th year, they have a heart attack and die. We think that at Gilead that the overall health spectrum should be broader than just HIV, TB, malaria. And that is why we have provided catalytic support, working with the Center for Global Health and Mike with MasterCard, and especially USAID, to look at how health can be distributed more broadly, utilizing either insurance companies or small to medium enterprises that are already delivering healthcare. And we think having catalytic funding and other support, we can create a healthcare system that is more holistic, that allows for individuals who are being treated for HIV, TB, or malaria, that their blood pressure or diabetic episodes can be treated as well. Not only would this create a healthcare infrastructure and health literacy, but working with MasterCard and others, we see an opportunity for financial literacy married to health literacy. And with the tools and resources Michael talk about that MasterCard's developing, I think we have, working with Center for Global Health and Development, we have an opportunity to provide a model that allows for broader comprehensive care, utilizing small to medium enterprises already providing healthcare. So I'll leave it there, and back to you, Joanne, and we can get further into discussions.
Thank you, Clifford, for those inspiring remarks. I'd like to welcome Michael Froman, Chairman of the Center for Inclusive Growth at MasterCard. Mr. Froman, it's truly a pleasure to have you today, you know, especially all your work, and I know some of your work from the Obama administration, and MasterCard's various strategic partnerships that many of our international participants here in today's audience have spoken about. So Mike, over to you.
Well, thanks very much for having me. And I think people may wonder, why the heck is MasterCard on a call around global health? And I'll tell you the story behind that. But what I like to tell people is that Amazon is not a river, Apple is not a fruit, and MasterCard is not a credit card company. We're a technology company that happens to have grown up in the payment space. And we have been evolving since then into a number of new areas, including touching on the area of global health. We come at this from a focus on inclusion, financial inclusion in particular. And 5 years ago, we set out the goal of bringing 500 million people into the financial system who are unbanked, underbanked, excluded from networks. We achieved that goal. We measure that like any other corporate priority of ours. Every region has goals, every country has goals, we programs, we track it. People are compensated in part on achieving their goals. And we achieved it about 9 months ahead of schedule. And then in the midst of COVID, we were looking around, and it underscored for us just how important it is for individuals and micro and small businesses to be part of the digital economy in order to survive and to thrive, whether it's the mechanism by which governments are providing support, or their ability to interact with their community and their customers. We doubled down. We said we're going to raise our goal now to 1 billion people, 50 million micro merchants, 25 million women-owned, women-run entrepreneurs around the world, making sure that they're part of the digital economy and that they can thrive. Along this journey of financial inclusion, we met Gilead. And I have to give Gilead credit for introducing us to the healthcare area. And it was through a pilot program that we did in Pakistan, where we used our simply a very simple card, a chip, as Gilead was rolling out its Hep C treatments, to keep track of how often a patient came into the clinic to get their various treatments. And when they failed to come in, to send them an SMS reminder. And that sort of entered us into the global health area. And we now have a partnership. It had nothing to do with payments, by the way. It was simply the fact that sorry, I'm having a trouble with Skype or with Zoom. The fact that we had a network, we had technology, we had encryption, and we had the ability to keep track of when people transacted, in this case, came into a clinic. And now we have a partnership with Gavi to do something quite similar, of being able to help give people digital identity, to keep track of the vaccinations that they're getting for their children or for themselves, to have an electronic health record effectively on their device or on a card, encrypted, so if they go to another clinic, they can keep track of where they are, to remind them of when it's time to come in for a booster or for another vaccine. And similarly, we're working with the Global Fund to see how to use our technology to address the challenges that they have, maybe even combining payment and healthcare to, for example, to keep teenage girls in places where they might drop out of school, get into trouble, become carriers of AIDS, to stay in school, to incentivize them to stay in school and to keep track of their progress there. And so sometimes it has nothing to do with payments. It's really about how to use our network and our technology. We're with the Gates Foundation and Wellcome. We created the COVID Therapeutics Accelerator, which now has, I think, more than a dozen participants and more than $300 million being put towards accelerating and expediting the development and deployment of treatments. And we hope to continue to provide our products, our services, our technology, our understanding of ecosystems, our network, to be able to help support the global health infrastructure, particularly in developing countries. I'll stop there.
Thank you, Mike. I think your views about innovative partnerships take a broader look at the whole ecosystem, and that really, is a call to action to all of us, not only on this particular teleconference, but really others. And Clifford, you talked about a vision of building upon Gilead's track record of providing access to critical medicines, to create a platform that offers sustainable solutions. What do you feel are the key building blocks that need to be in place to achieve this vision? And what is the role of small to medium enterprises, especially those led by women, as I am a woman of a business myself?
Yeah, no, it's a good question, Joanne. I think you need individuals like MasterCard who really has the technology, and you need entities like Gilead to help provide the catalytic funding and support to come together in a public-private way, engaging governments, working with individuals like USAID and governments in countries. In many ways, it's at times NGOs, but looking at these small to medium enterprise to figure out how can we incentivize future growth? How do we provide seed funding for these small to medium enterprises to increase their healthcare offerings? In many ways, you're providing financial security so that businesses run by women and are small and have the ability to grow. You're then providing the funding for them to be able to expand. That creates financial security, but you're also doing it with health as a strategic priority, and you're putting it on a technological platform that is smart. It has a digital ID, it has a voucher, and that voucher is exchanged for healthcare services. I think you need to answer your question, Joanne, you need a combination of individuals at the table, which is why I like where we are with MasterCard and USAID and your team, Joanne. We're working collaboratively to see how this can be solved, both in different phases. Of course, what you do need as well is a technological platform that all of this information sits on. And I think that's what Mike and others are looking at.
Thank you, Clifford. Michael, in terms of MasterCard's vision of inclusive growth and how it's working to promote access to critical services and support economic mobility, what are examples of MasterCard's partnerships that have enabled financial and digital inclusion and improved access to basic services, particularly in health?
Sure, and just to build on what Clifford was saying, I'll give you an example that in Kenya, we partnered with Unilever and a local bank and digitized the relationship between micro merchants, those, the tiny stores at the end of the road, and their Unilever supplier, so that what previously had been done completely in cash and therefore was invisible to the financial system, now a bank was able to look at the flow of funds between somebody who owned a little store and Unilever and say, okay, this person tends to buy so much, tends to sell so much, there's a regular bit of economic interaction going. With that data, I can now offer credit. And the bank began to offer credit, which allowed the micro merchant to buy more from Unilever, which Unilever loved. It allowed them to earn more and serve their customers better, which the micro merchant loved. And the bank was getting repaid because they had reasonable assurance based on the data. And so that micro merchant, she was finally brought into the financial system in a way that allowed her to expand her business, create greater financial security, to what Clifford was just laying out, I think one thing we should be exploring is how do we take that from, in that case, a consumer products environment, Unilever, to a health environment. That same small business that's providing a health service, what can we do to sort of help digitize that relationship between that small business and their suppliers, their partners, so that they can begin to get access to the finance they need to expand their services, to grow their capabilities, and therefore to strengthen the healthcare infrastructure as well. That's just one example. We've been doing things with, that's in the micro merchant space. We've been doing things with coffee growers and now with cocoa growers to help digitize the way they get paid so that the farmers actually get paid more, because you cut out the middleman. They're getting paid 20, 25% more. They're able to support their families. They're getting access to information about fertilizer and crops and the weather and prices so that they are more effective and are able to earn a better living. And then we're also working with a whole series of microfinance institutions around the world, Axion being one network, to help modernize the technology of those microfinance institutions so that they can begin to get capital out to small business, whatever sector they're in, whether it's healthcare or micro merchants or otherwise, to be able to expand those businesses more effectively.
Wonderful.
Thank you so much. And I know we have such eminent discussants also on this and panelists. So before I turn it back to you for our chat, Clifford and Mike, I'd like to turn it over to Gerhard, who is the CEO of Sirona Asset Management. Sirona has invested in a lot of blended financing and worked very closely with the Canadian government to deploy these types of blended financing partnerships. So Gerhard, I'd like to give you a moment to comment on the discussion to date that both Clifford and Mike have raised.
Thank you. Thank you so much, Joanne, and what a pleasure to see all of you again, Clifford, Michael, etc. This is like a little bit of a coming out party after being enclosed by COVID for so many months. Thank you for this opportunity. And Mike, you said that Amazon isn't a river, MasterCard isn't a credit card company. I thought until you said that's exactly what MasterCard was. So I'm glad to hear that. Sirona also isn't that song from the 1980s that you remember. It's actually an international financial intermediary investing in small and mid-market businesses across emerging markets. So very, very apropos that you asked the question, Joanne. Indeed, there's great interest by investors to invest in emerging markets, in small business, in mid-sized business in emerging markets, particularly these days as it addresses healthcare concerns. COVID has brought that to light. I'm interested, Joanne. You asked what might I ask of Clifford and Michael. We talk often about unique instances where MasterCard has partnered with Unilever on a project or on an initiative, and Gilead has been in Pakistan and in different places doing this and that. How do we, in referring back to the subject matter of this conversation, how do you move that those individual relationships, those individual projects, those individual initiatives into a platform, a more systemic way of relating? Is there a way that you can envision, Michael and Clifford, envision a way of working together in a more systemic way so that we address it not on an idiosyncratic one-off solution, but rather something that's broader and more sustainable, covering greater parts of the market?
Yeah, no, I'll take a quick stab, and then Michael, please. I think what we're looking at and what we've seen is that you need to create an Amazon of health. And on the front end of that is technologies from MasterCard and others. And what we see, Joanne and I and others, as we've been trotting along, looking at well, how do we ensure that the woman who just delivered a baby and the baby is healthy, the baby is not HIV positive, the woman is, but the baby has been born HIV negative. How do we ensure that several months later that woman doesn't die of childbirth, complications from childbirth? And so you need comprehensive care. We think that if you create a platform that allows you to get to small to medium enterprises that are already providing healthcare on the front lines. That platform has catalytic funding, first loss capital, private equity funding. So you have the financing to inject into these already established systems, whether they're diagnostic, health, or health literacy. With putting a MasterCard technology on the front of that platform, you're then providing a card-based system that allows for an exchange of healthcare services via a voucher. But that also creates financial literacy as well. And so you're talking socio and economic health security married to financial and health literacy. Michael, you want to chime in?
Sure. I mean, Garrett, your question's right on, and focusing on not just pilots, because pilots they're not easy to do, but there are way too many of them. Lots of flowers blooming, and we need forests in these areas, and so we are all about scale as a company. Like, it's a scale business, and our whole approach to technology is exactly what you laid out, which is how do you create platforms that can scale? And in this area, what that means, we've been building out a platform called Community Pass, which has a digital identity that is appropriate in developing countries, highly focused on privacy, the rights of the individual to control their identity and all that. Which is sort of core to who we are as a company, that has a ability to share information across use cases. So from our perspective, right now, every humanitarian organization in Africa signs up somebody, gives them their own ID. There's no interoperability in the system. And our idea is if we can have a digital identity that not only Gavi and the Global Fund will recognize, but Mercy Corps and Save the Children and UNHCR and the World Food Program and the local bank, because if you come into the system as a mother of a child getting vaccinated, you then send that child to school. We have an application that helps people manage their payment of school fees and helps give data to the government on the economics of their education system. And that same woman who vaccinated her child, sent her kid to school using that same technology platform, may also be a farmer or a merchant, and may plug into our farmers network or may plug into that Unilever kind of platform using the same ID, the same data layer, so that there can begin to be that scaled opportunity. If we create that, as we create that infrastructure and roll that out, other organizations can plug into it. It's all open architecture. Whole idea is for it to be open and interoperable. They'll plug into it with their own use cases. And so, there'll be some farmers organization or some health organization that has their own interest in reaching the base of the pyramid and can then plug into the same kind of infrastructure. So that's our goal. That's our go-to-market, so to speak. More broadly, we sort of pilot, we develop use cases, we partner. It's all about a network. We want, dozens, hundreds, thousands, millions of participants coming to the network in their own way. And we just help provide the scalable infrastructure underneath it, in partnership with governments, international organizations, NGOs, and the private sector.
Thank you so much, Mike and Clifford and Gerhard, for that question. We do dynamic, so we will be, going back and forth quite for a couple of rounds. But with that, we did talk about public-private partnerships, and Mike, thanks so much for the mention of the platform. I know in many of the partnerships that some of the partners here are engaged in, they're using some of the financial and digital tools. I would like to turn it over to the Deputy Director General for the Japanese International Cooperation Agency. And thanks again for joining us so late. I know you went out of your way because it's so late in Japan. JICA has a long view that health is a basic human right. And as you've been hearing, from both Clifford and Gerhard, and then also, Mike, in terms of, what's needed to address these human rights. What are the tools, the financial and digital tools? What are the different platforms, that are being executed as the center's working with, Gilead, USAID, and MasterCard to implement these different platforms. But from JICA's perspective, I know that you are doing a lot to support small to medium enterprises that are critical to the delivery of services. You've done things in blended financing. So what do you see the role of JICA in some of these partnerships for health technology and financial inclusion?
Thank you very much for Joanne for inviting JICA for this very interesting roundtable. And thank you for very inspiring discussion between Clifford and Michael. Thank you very much. Joanne, as you mentioned, the health is really one of the pillars of our cooperation to low and the middle-income countries. And we have extended our support over 100 countries. And in that, let me first say that, our principal partners are still with the public sector. And we're investing on the capacity development of the public sector. And that really had a very impactful results, particularly in this time of COVID-19 pandemic. One of the such example is that long-standing partnership with our partner in Ghana, which is Noguchi Memorial Institute for Medical Research, which JICA helped to establish over 40 years ago, and we continue to partner with still. And then they are providing like 20,000 PCR tests a week. And covering like 80% of a total PCR tests conducted in Ghana, and they are the really driving force for Ghana efforts to fight this pandemic. And another example is our partnership with the Chorai Hospital in Vietnam. Again, the partnership dates back to the Vietnam War area. Actually, we helped establish the hospital, and we continue to invest in the human resource development. And now Chorai Hospital is one of the reference hospital to treat the very sick patient with COVID-19. So I think we really strongly believe in the need for investing in people. Not only the infrastructure, but I think the people is the key to any development issues. And that also the same with our partnership with the private sector partner as well. And I think another example maybe is it's not really a private sector, but I want to share another example with our partnership with the vocational training school in DRC Congo. They have come up with this idea of producing a water dispenser so that the people can wash hand without touching any taps or things. The sensor can test your temperature as well, and then with the sensor, the water is automatically dispensed together with the soap. So I think we strongly believe in ingenuity and entrepreneurship, but I think that always comes back to the importance of human resources. So I think continue to invest in human resource is really the key to develop for the development of the countries and also the private sector as well. And now we are expanding our partnership with the private sector as well. Again, with the importance of human resources in mind, one of such program is what we call is the ABE program, Africa Business Program, and with that we are inviting students from Africa to come to Japan to study in the top-notch universities in Japan, but they are the ones who are expected to work in the private sector, not in the public sector. We are providing a lot of the training programs for public sector officials, but this is really for the development of the private sector. So they are expected to go back to their own countries, but continue to contribute to the development of the private sector. So many of them are employed, or some of them studied their own programs. So I think they are, they're contributing in their own ways to the health and other development issues. So I think what I want to emphasize here today with you all is that it's really the human resource. I think investing in human resources, this is really the key for both the public and private sector development. Thank you.
Yeah, thank you so much. Thanks so much for your comments. And I know JICA has been a great partner, in a lot of the work in global health. And so, many of the partners, including us, continue to look forward to working with you. I'd like to turn it over to Osman, CEO for Rosen, to see your comments on, both Mike and Clifford's, thoughts. And also, I know that in terms of local manufacturing now under COVID-19, it's more important than ever, the investments in small to medium enterprises. But Osman, over to you.
Thank you so much, Joanne. It's a real privilege and a pleasure to be part of this discussion. Hi, Clifford. Hi, Mike, everyone. We've had the good fortune of having partnered with Gilead around 2015. When the treatments for viral hepatitis came along, and through this unique model of access, together we were able to treat and cure over 100,000 patients in Pakistan in the first year and a half or 2 years. And we were also part of the pilot the first pilot that Gilead and MasterCard did in Pakistan, which was treating these patients of hepatitis C, merging health with the digital financial inclusion technology. And I think it's a potentially a very powerful combination when you marry financial inclusion with healthcare inclusion. For example, and I'd sort of like to throw this idea to Michael, that countries like Pakistan, which are under-resourced and have large expat populations that are that form the diaspora that really helps these economies keep going, potentially can be tapped to provide healthcare funding to address these really critical healthcare challenges that the government alone can't fix. So viral hepatitis is a classic example in this case. What the MasterCard pilot showed us in Pakistan is that you can very transparently track the entire patient journey from diagnosis to treatment to cure, and be able to demonstrate that to a potential funder of such a treatment. And when you have, say, the Pakistani Physicians of North America, which is a very large professional body, have a couple of thousand physicians who have done financially well in their lives and want to give back to their community, you could use this product to then help fund and demonstrate to these donors the benefits of their funding. I think this diaspora funding of healthcare could be a great way that this combination of health and technology like the MasterCard product could come together and create these new opportunities of improving health conditions, both for critical diseases, but also for primary healthcare, because for large parts of the developing world, the really underserved portion of the health conundrum is actually primary health. So as Clifford was saying, it's not just that you have disease like HIV or viral hepatitis. What happens when that same person who's cured of hepatitis tomorrow develops diabetes, uncontrolled diabetes, or heart disease? So the primary end is really where a large-scale intervention would have the most impact.
Clifford and Mike, would you like to comment on what Osman's suggestion in terms of diaspora funding and the way to fuel some of the sustainable health solutions?
Yeah, no, I think in the comment about investing in human resources before, and then Osman's comment about the diaspora funding. Look, what we see is that, as Osman just mentioned, the primary healthcare, we're focused on infectious diseases at Gilead, but the primary healthcare seems to be the piece that are now causing more mortality or complications. And so I think if we don't focus on broader sustainable healthcare, utilizing existing frameworks with SMEs that are already delivering it, if we don't create an Amazon of healthcare where you have these SMEs, you have Mastercard's technology, you use private sector, government, philanthropic, and other investors to create a platform where this is all integrated, then what Osman mentioned, someone will have been cured of Hep C with our medicines through Furosans, and then die of some minor complication, not managing blood pressure or diabetic episodes. So we need to think more broadly. We need to think more holistically, Joanne. And I think the marrying of technology and then health security, because health is wealth, but then to maintain or grow wealth or grow your income, you need financial, technological literacy. And that's what I think MasterCard, with its vision to reach 50 million SMEs. I think, Mike, you have the numbers. Maybe I'll stop and you really tell us what the numbers are for the MasterCard goal.
Well, just on Osman's point, I think it's a very good one. And whether it's to mobilize contributions from the diaspora, or more generally be able to do a case study of what we did with Gilead, for example, and yourselves in Pakistan, and say, okay, this is, when you do it with technology, therefore you create visibility and you have data, you can now go to potential funders, potential investors as well, and say, if you're looking at impact investing, for example, blended finance, as Garrett was talking about, this is what the results can be, and we can track that. You're looking for, people are looking for results. And so I think I'm happy to go back and we can talk with Gilead about, I'm not sure we've ever written up our experience as a case study that one could share with either the Pakistan physician diaspora or more broadly, people who might be interested in investing and contributing to global health.
Oh, Clifford, you're on mute.
Mike, we should look at that case study because it was the catalyst of you can reach individuals and you can remind them to finish the course of hepatitis C treatment so they can be cured, and they're interested in saving their money or putting it on a system that is digitized. So then you have all this data on individuals, and with data, if you see that a young lady is coming in or a young man is coming in for their second treatment of STDs, we know that if the probability of developing HIV after multiple STDs is extremely high. Then a healthcare provider in an SME can start having a conversation with that patient about PrEP, or drug to prevent HIV. That way you can prevent having a a young person having to live with HIV for the rest of their lives, and possibly their children as well being infected. So there's a host of opportunities here with primary health care where prevention, health literacy, and financial literacy are concerned. It's an inclusive approach that this platform will offer, the Amazon of health care.
And I think this goes a bit to Gerhard's question as well, because we're partnering with USAID, DFID, some of the Northern European aid agencies, as well as, of course, Gates Foundation and others. But having these, one way to scale is to create investable opportunities for humanitarian development organizations or impact investors to really identify and say, okay, I now see the data, I see the results of the pilot, and I have reasonable confidence to be able to help provide the resources to scale that up as well. So we're happy to, again, work with anybody who wants to partner in this area.
Yeah, because when these SMEs grow, they can become more profitable. If it's a nonprofit, they create jobs. You know, the economic impact to the country as well will be much greater because you're investing in the growth and evolution of a healthcare system with a financial capabilities built into it as well.
So Clifford and Mike, I challenge both of you. You know, I know we're currently, engaged in working in Uganda and Pakistan, but maybe we broaden it to other countries like India. I know, and others. I think it's important, the digital financial inclusion on the platform. And also, Mike, as you mentioned, the investment into those women-led SMEs. And I'm always preaching that because I am a woman myself. And I think, growing women SMEs, as we've seen in the healthcare sector, can have such a great impact. And, we actually host a network of some of those women SMEs, and their growth has been, incredible. With just a little bit of investment, they return such dividends. I know Gerhard and others, have seen that over and over again. But with that, I know we have so many great participants and expertise. I'd like to turn it over to the ambassador from Finland, because I know just earlier in the week, you had spoken about the robust need for data collection and aggregation to improve statistics, which is what Clifford and Mike have spoken about, especially now during the pandemic. How do you see the role of digital health, as, both Clifford and Mike and Gerhard and Osman have been talking about more broadly, in order to break that cycle of poverty for millions of people in the emerging markets?
Thank you. And it's really great to be here. And I've been listening to the discussion. And one point I would like to take here first is that governments and then the network and multi-sectoral and multi-partner cooperation is really needed now, because you can innovate great solutions, but if you can't scale up them, there is not a possibility to use them and get then impact out of them. And Finland has been championing quite in front line with trying to create a legislative framework, but also a regulation framework, and then facilitate ecosystem where you can then innovate, develop then solutions, and for being a taxation-based welfare society where we have universal health coverage and also social protection, we have been able to build during the past decades good trust from our population. So they are very positive then for research and development. And what we have also noticed that when a society has already taken up the use of digital services, be it then telemedicine or more broadly public services, it is easier to ramp up the provision and the use of digital services during the use of the crises also. And what is also, I think that this crisis have shown us is that also sectors beyond health sector is really an important part of the society, and there also comes the need that we have to have solutions not only for healthcare but also for people supporting people's everyday life. About the importance of setting norms and discuss about the ethical issues, I see that the United Nations and WHO play very big role in this, and we have been also playing active role in the follow-up to last year's report of the UN Secretary General's high-level panel on digital cooperation. And we are leaders on the way forward on the report's recommendations related to artificial intelligence, and then also taking part in the chapter where there is aiming to get public good out of digitalization. So I would like to bring up here then the aspect of government's role then enabling then the development of innovations and scaling up of them, but also then the government's role and need to together then to discuss about the norms and also the ways, the solutions, and the data economy can grow and flow over the cross borders. That is really needed, and we have seen now really big leapfrog of digitalization, and also people have been adapting then the digital solutions very well. Also the older people here in Finland and in Europe and Africa has played very an active role in showing the way how digitalization then can really help during this COVID crisis. So we need this kind of discussion that we now have here, that we put then also the financial sector and economical sector and private sector then having a dialogue between then governments and these multilateral organizations. And I'm very pleased to see that how UN organization has really and is playing a big role in trying to enhance the dialogue according to a use of IA and sustainable use of IA and digitalization.
Thank you so much.
If I can add, the ambassador is spot on. The role of governments is really critical. I think, you know, when we started thinking about this platform that would allow for more comprehensive healthcare, USAID was one of the first that agreed to walk this journey with us, with a phasing of some initiative in Uganda. And I just want to compliment Bill Steiger and his team for being true visionaries and recognizing that, you know, when you look at the PEPFAR and Global Fund and where billions of dollars are spent, it's on these 3 diseases, and that it can't just be a focus on HIV, TB, malaria, that it has to be broader. So kudos to USAID, and the ambassador is right. You do need more governments and agencies really leaning in and trying to figure out how do we provide more holistic healthcare, to Osman's point, primary healthcare.
Mike?
Can I comment as well? First of all, I completely agree with the ambassador's comments. And, I spent about 2/3 of my adult life in government. And we talked a lot about public-private partnerships when I was in government. And usually that meant we wanted the private sector to write a check, to give us money. And that's not a sustainable model going forward. I focus a lot on how do we get the private sector to work better with governments and nonprofit organizations. And part of it is that the private sector has to be much more sensitized as to the normative values, the priorities of governments, their completely appropriate and legitimate role in setting the parameters for areas around global health, but also around issues like privacy. I mean, the more we digitize, the more data that's being collected, and it has to be dealt with in a very careful way, particularly health data. And so I think working very closely with governments and international organizations on what the appropriate privacy protections are is absolutely critical. But let me say something that's perhaps a little controversial on this for this group, which is I think that the government sector and the nonprofit sector also have to open their minds a bit more to the way the private sector operates. I've been in conversations in the global health area where somebody across the table will turn to me and say, yeah, but you just want to make money. And my answer to them is, we're a company. Yes, you're right. That is one of our goals. And you should want us to have that as a goal. Because if this is left just to our philanthropic efforts or our CSR efforts or our ESG efforts, then it will never be scaled.
Yeah.
You should want us to, and the way we approach this part of our efforts in the business side, it's not to make this the same margins we make in our core business, but it's to break even. It's to break even plus, so that we can continue to reinvest in it. Because otherwise, when times turn bad, and times are bad right now, more broadly in the economy, this is the first thing that gets cut out. So you want us to pursue what we call commercially sustainable social impact. And the public sector and the civic sector need to get comfortable with that, just as the private sector needs to get comfortable with following the lead of governments, particularly when it comes to issues around privacy and regulation.
You're completely right, Mike. And, I think that's important for a lot of institutions, especially governments that we work with. And we've worked the past year to launch a lot of blended financing mechanisms with the US government and, others, including Canada. But I'd like to, on Mike's point, really, turn it over to our representative from Africa CDC, because I know Africa CDC is, currently looking at some of these blended financing mechanisms, working with private and public sectors to address COVID-19, to give some remarks on the conversation to date, because I know that investments in health systems are important. And as you also have the dual role as head of Africa's CDC work, not only in public health, but co-chair of the African coronavirus response. How do you see some of the discussions both that Mike and Clifford have raised for that relationship between health and economic, and how we can really right now deploy some of these resources to make them sustainable, as Mike and Clifford were saying, and not really, based on just grants?
All right. Thank you, Joanne, for the invitation for Africa CDC to be part of this great discussion. I think for me, I would like to say that this is quite timely, because the COVID-19 has actually affected virtually every sphere of either government or private or public sector. more importantly, the COVID-19 is also bringing about the need to reset a lot of things, you know, including the way health is going to be financed and so on and so forth. So looking at the discussion that's taking place so far, let me start with the financing. First, Africa CDC is a specialized technical institution of the African Union. So it's a public health agency that is housed within a political institution. And in terms of financing, we derive most of our finances from contributions from member states. But you will agree with me that that is not going to be anywhere near what is expected. Because even when you go back to our member states and realizing the fact that the same member state came together in 2003 and agreed that 15% of their GDP should be spent on health, today, we have more than 90% of our member states spending less than 10%, in fact, in some places, less than 5% of that on health. So quite a lot of member states still depend on grant and all those things. So for Africa CDC, I think what we've done to be able to complement what member states is to put in place a public-private partnership sort of arrangement. I'm glad that MasterCard is here. I think they are one of the main supporters of Africa CDC response to the COVID-19 on the continent, and they've done very well, you know, in terms of supporting us with test kits, you know. So I think going forward, if we look at the financing of it, I think for us in the developing world, we need to begin to look inward. We need to begin to mobilize domestically, you know, to see how do we do it through different means, whether be taxation, be it raising duty on some certain luxury goods and so on and so forth, even the tourism industry to begin to look at that, because as Michael rightly said, depending on all these grants is not something that is sustainable. So for Africa CDC, we have put in place what we call Africa Public Health Foundation. And this will allow us to attract resources from the traditional partners and from non-traditional allies. And that has been so far so good. That was launched at the World Economic Forum late last year in South Africa. Permit me to also make mention of what we've done in terms of our technology, because that has been discussed extensively here today. And I think the use of technology is one of those things that actually allowed Africa CDC to properly coordinate and collaborate the COVID-19 response on the continent. And that has yielded a lot of results, as most of us know. Today, the case, in terms of case number, we are less than 10% of the global total. In terms of mortality, we are less than 5% of the global total. So all this boils down to technology. First, in terms of making medical supplies equitably available, Africa CDC have put in place a digital platform. This was largely due to support from the private sector. You know, so this has allowed most of our member states to have equitable access to these medical supplies. In terms of surveillance, we have deployed IT or technology to support this. Even in terms of capacity building of different member states, as you all know, most of the borders are closed, we're not travel. So support member states in terms of our technical support, giving them the necessary training has always been through the technology platform. So there's no way we can put this COVID-19 pandemic under control without the required technology. Even in terms of continuity of essential care that Clifford has mentioned a lot, HIV, TB, malaria, you know, vis-a-vis the COVID-19, one thing that's allowed most of our member states to continue to run some of this program is through the telemedicine platform, you know, a kind of a digital platform to support the continuity of routine health services. So technology is part and parcel of what you do in terms of public health response, especially during emergency outbreak. I'll stop there and allow others to weigh in as needed. Over.
Thank you so much. And I know, you know, having worked so closely with John throughout the years, head of Africa CDC, I think it's really innovative, a lot of the thinking that you're doing, especially around, you know, this new platform. So thank you so much for joining us today. Mike and Clifford, if you want to give some comments.
No, I just think, you know, we have 3 eggs in one basket. You have HIV, TB, malaria in one basket, and that's where all the donor aid has gone. And COVID-19 has shown us that while those three diseases created relatively good healthcare systems, infrastructure, and health literacy, it needs to expand beyond these three diseases if we really seriously want to help emerging economies and emerging countries evolve. Because health security and financial literacy will be critical from a social and economic perspective. And I think what we aim to conceptualize with a platform that has the ability to aggregate small to medium enterprises that are already providing healthcare and give them as much financial boosting as they need to expand their services is an approach that is the Amazon, but is the Match.com kind of concept that allows you to work with Africa CDC and MasterCard and Apollo Hospital and USAID and others. So I'll stop there, Joanne, because I think we need to.
Yeah, and before you respond, Peter is here from USAID and has to jump off. So Peter, I just wanted to ask the question in terms of, I know USAID has been doing a lot of work in blended financing to date to address COVID-19. And a lot of what's being done, really in terms of, using those innovative technologies, those tools that USAID has done. So Peter, if you could give some comments in terms of, some of that digital and health solutions that are being deployed.
I don't have too much time, but we are trying to, I work in the Center for Innovation and Impact, and we are trying to develop new tools to be able to get into this space. We recognize that this is an important part of being able to get access to healthcare in the future, really being able to work with the private sector. This also aligns very closely with our agenda for the road to self-reliance. So we are doing what we can with COVID and in other areas to create better platforms where we really look at these market dynamics and see what are the things that are enablers for the private sector to get in, and often just getting that kind of seed capital, getting blended finance at the beginning, this sort of thing are things that can be helpful.
Thanks so much, Peter. I know you have to run to the meetings for COVID-19, so thank you for making time. And also, in terms of some of the discussions, we've mentioned a lot of the work of the UN agencies and around innovation and partnerships. So Pradeep, a dear friend, we've been working on a lot of different partnerships together throughout the years. Really wanted to hear your comments in terms of what Mike and Clifford have been talking about for digital and health inclusion, and also Gerhard and Osman and others from Finland, JICA, and Africa CDC.
Joanne, thank you very much for facilitating such a conversation. It's really fantastic to see this kind of what I call usually the disconnects in the health sector, which is you often have people from the health sector speaking to themselves and often not speaking to people from either the financial sector or technology sector, or usually it's a very internal conversation. So it's fascinating to see this happen. I think for me, I see three major challenges, and many of them have been addressed. One is the disconnect within the health sector and across health sector. And I'll give you a simple example. My day job these days is to work with ministries of health to identify their pain points in delivering access to healthcare. Working then, once the areas identified, the pain points identified, working with innovators to bring new ideas or existing ideas and adapting them to meet those needs, and then working with the investment sector to take those innovations to scale. Now, what happens is that we have been working with several countries now, and then every country, after some time, the minister will say, oh, it's fantastic to see these digital tools which are there, but 50% of the primary health centers in Africa don't have access to electricity. So we said, okay, why don't you go to your electricity minister and have that conversation? And it's like, no, 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 we don't talk to each other. So how do you bring the Ministry of Energy to work with the Ministry of Health? Because without your electricity, your basic healthcare is not going to be, you can't deliver it. And many of the tools, including the financial tools that we have, cannot be delivered. So that's one disconnect within Ministries of Health. Two is the disconnect between the private sector and the public sector. I do believe that if we need to have impact on health, we need to have scale, and we need to have the public sector buy-in and engagement right from day one. Unfortunately, the public sector, I think someone already mentioned it, the lack of trust which is there, and also the perceived rationale or the incentive for which the private sector is coming, that needs to, you need somebody who's an intermediary who brings these two worlds to work together. And that's a role that we have been playing a lot. Three is when it comes to also the disconnect between the ODA, I know we have at least a couple of donors on the call. The traditional donors are still not willing to take risks and to rethink the development investment model. Let me just illustrate that. The total investment when it comes to ODA last year was just a little bit below 150 billion. Whereas even if you just take the private equity investment market, that's about 4 trillion plus. So how do you leverage that 4 trillion using the 150 billion rather than looking at how do I spend this 150 billion for impact? I know Gerard has done quite a lot of work around these models, and we need to see how donors can take much more risk. The last one is incentives. Today, there is a lot of incentive for each one of us to work in our silos. I know there is some resources available for TB, HIV, and malaria, but even they don't talk to each other because there is competition for funding. And that's where I really see MasterCard's ability to bring all this data together. Because if a person is on treatment using Global Fund resources for HIV, and then if they're also on treatment for tuberculosis using Global Fund money, that needs to talk to each other. And how can we put in place systems? Today we have the technology, but there isn't anybody who's really taking a macro picture. I don't know whether it's an Amazon for health that is needed, or whether it is much more a liberated kind of let 1,000 flowers bloom, but somebody who really orchestrates that music. But I do see huge potential for rethink when it comes to global health, and that it's good to start this conversation, and it'll be wonderful to see how we can bring together a group that will continue to take some of this forward. I'll stop there, Joanne. Thank you.
Thank you, Pradeep. And before Clifford and Mike, you comment, I know Rahul, has to go. So Rahul, over to you. I know, in terms of the work that Apollo Hospitals is doing, a lot of the digital health and financial inclusion solutions that both Mike and Clifford mentioned are key, as you are actually the implementer. So Rahul, you come, with rich experience and expertise in deploying some of these different solutions.
Well, thank you, Joanne, and thank you for hosting and this, and it's a great conversation. So Apollo Hospitals was founded in 1983 with one hospital, and today it's the largest health system in South Asia. 72 hospitals, 10,000 beds. We've treated 150 million people to date, but that still leaves billions of people who don't have access to healthcare and who still need treatment. Now, how do you really, how do you go beyond 150 million people? How do you treat 1 billion people? The reality of that is that's not going to happen in the walls of a hospital or a clinic. It's going to happen outside, and it's going to have to happen with new models, new ways of doing things. And that's where we see digital health and technology playing a big role. And we were seeing it before COVID. It was certainly accelerated with COVID. This idea that you can use technology to engage with more people at a lower cost in a more convenient way. And so we just see that trend continuing. And it's not only in South Asia, but certainly in developing countries. If you look at the cell phone model, right? In the Western world, we had landlines, right? We didn't really need cell phones. But why were countries like India and China able to really leapfrog what we had in the West with cellular technology? It was because they didn't have anything before and they needed to implement a solution. You know, necessity is the mother of invention, right? So we see that happening with healthcare. We have this opportunity now to really leverage technology to drive access as well as lower costs. And now part of that also is you can have a great technical solution, but unless people have the ability to pay for it, it's all for naught. So, you know, the other part of this is certainly the financial inclusion. All great points that we talked about today. You know, the ability to get access to pay for healthcare. And this is where I think, you know, innovative new models for financing, for paying for healthcare come in. So, you know, a good example might be, you know, we talk about public-private partnerships. So in India now we have something called Ayushman Bharat. Colloquially, it's called Modi Care, where it's a program to ensure 500 million people, right? To the tune of roughly about $6,000 a year. It doesn't sound like a lot, but in the Indian context, it's quite a bit. But there's still a lot of treatments that are going to cost beyond $6,000 in a year, especially when you're talking about a family of 5. So when you look at opportunities like, you know, challenges, there are also opportunities in the sense that now could we figure out a public-private partnership where you offer maybe some supplemental coverage on top of a program like Ayushman Bharat to cover more people, to cover more treatments, and not only for acute care, but also preventative care, right? And the reason that's important is when you look at India, in a lot of the other parts of the world, right? Diseases such as what we call non-communicable diseases or lifestyle diseases, such as diabetes, cardiovascular disease, hypertension, cancer. These are actually bigger problems now than, and to Clifford's point, things like tuberculosis, malaria, and HIV. So the ability to treat people, preventative treatment throughout the course of their life will certainly play a big role. And, you know, I think we can easily see technology playing a big role in helping manage that.
Yeah, valid point, Rahul. And it's great what Apollo has an infrastructure with 10,000 beds that can really help to accelerate things, particularly when we're looking at remdesivir, or drug at Gilead to treat COVID-19. It's an IV drug right now. We're working on an inhaled version, but right now it requires some level of triage or hospitalization. So another example of the collaboration and the platform that we're looking at to provide, you know, both ambulatory and in-hospital services in addition to pharmaceutical services. Joanne? Joanne, back to you. I don't know if you...
Sorry, I had a technical glitch there for a second. Mike, I don't know if you had other remarks.
No, look, this has been enormously useful for me just to hear everybody's perspective. And I think the one thing it underscores in many of the last comments has been the importance of pulling together the whole network of players that are working in this space in various ways to facilitate greater collaboration. We're happy to be part of that, and look forward to following up with many of you.
Yeah, and before we end, I'd like to turn it, we have Wally and Gwen, I know Prudential UK, you know, doing some work, especially Wally, you know, as Sideline really has some of the innovations that both, you know, Mike and Clifford have talked about. So Wally, I don't know if you had any thoughts on our discussion to date, and then, you know, not least but last, Gwen, you know, I know Prudential UK. So Wally, over to you.
Sure. I'll be brief. Yeah, I mean, discussions today just sort of taking that term all the way back to years ago when we first met. You know, a lot of talk about artificial intelligence. I think that you know, the conversations today, it seems that there's sort of I think we're all sort of groping around to try to find the proper bridge between healthcare outcomes, blended financing, and technology has come up several times over this conversation today, and AI specifically mentioned. I'd like to propose just a brain exercise to sort of, when you think about AI, you know, you can look at AI to me is the computational process to create data assets, but I think what you're more interested in is the value of data that you can extract from AI. And I think it's especially interesting to think about how that integrates with blended finance, public-private partnerships, because data assets themselves, you know, they can become part of a financial model. We're actually involved in a couple projects dealing with food security, one dealing with healthcare assets specifically, where if you can use the proper infrastructure to preserve the value and privacy of data, it's been said that longitudinal health records can be valued with the genetic profile at about $6,000 per person. You know, if you can harness that value of data, I think it gives an interesting tool so that blended financing and other sort of special purpose vehicle, I'm not a finance person by any means, but I think there's a real opportunity to look beyond AI methods, how that you can instead build data value and incorporate that into financial models.
Thank you, Wally. Gwen, I know that, you know, Prudential UK is one of the largest insurance providers in Africa, and I know you've been using a lot of this digital and financial inclusion, and, you know, our discussions also, you know, around a healthcare access platform. So Gwen.
Okay, thank you, Joanne, and thank you to everyone who's spoken. Such a rich and diverse range of opinions on healthcare, and it's really a privilege to be here. So I think from a Prudential perspective, specifically Prudential in East Africa, we address financial inclusion and access to healthcare through the needs we've identified. And the needs we've identified are around financial literacy, road safety, and commercially through the distribution of microinsurance. So our financial literacy program is about making financial education available to young people and children who would otherwise not have access to it. For example, Prudential developed a global financial education program aimed at primary, elementary school age children, dubbed Chaching. We have 6 structured lesson plans for teachers and volunteers who implement Chaching in schools, including videos, discussion topics, activities, and games. And as part of our response to COVID-19, we provided about 18 videos of Chaching content to parents and their children across Asia and Africa for free. Even as I say that, I think it's important to mention that there's very little evidence that any effort is made at a young age to teach young children about financial literacy, particularly on our continent, which usually means people grow up without the core financial skills that would allow them to provide, protect, and preserve for their families. According to the WHO, globally, there are around 3.5 million people who die every year due to unintentional injuries, and 3,000 adolescent deaths per day worldwide happen, which could be prevented with better preparedness and access to health services. So what we've done as Prudential is we have a program that we call Safe Steps. And Safe Steps helps to save lives by providing critical life-saving information and training on natural disasters, road safety, and first aid. And we have to date reached over 80 million Africans through our partnerships with the private sector, with governments and humanitarian organizations. And together we think we are saving lives. We also...
Oh, go ahead.
I'm done. But we also offer microinsurance in sub-Saharan Africa through our partnerships with mobile phone operators, microfinance institutions, and insurtechs. And that speaks to a lot of what has been said today, which is how do you incorporate innovation and digitization to through the business models that we use, both commercially and as part of our corporate social responsibility, to ensure that inclusion does happen. The conversations that our financial advisors have on the ground actually make sure that we reach people who would ordinarily not be reached, and we're also providing the same content digitally.
Thank you so much, Gwen, and it's been great to work with you, on the different healthcare programs. So thank you for your comments. I know many of you could, really talk at length about this. So, as I think Pradeep mentioned, getting this together and working with, next steps will be important. Clifford, I know Mike had to drop off, so I turn it over to you. And thanks everyone for joining today. Clifford?
No, thank you, Joanne. I think this is really a fruitful dialogue. In sum, I'll say that we believe that working together through innovative partnerships that look at sustainable approaches that deploy both health and financial solutions alongside each other will not only allow for countries to more efficiently manage their healthcare systems, but break the cycle of poverty and unleash the potential of for emerging markets to evolve, in a social and economic way, where health is a strategic priority and financial literacy and inclusion is part of that growth and evolution. We believe a platform working with USAID, MasterCard, and the Center for Global Health and Development, creating not necessarily the Amazon, but it's a visual or a conduit that allows for us to inject small to medium enterprises with the resources they need to provide primary healthcare at the base of the pyramid is critical. And as the ambassador mentioned, the role of governments is critical because, as someone else mentioned, you have to make sure that the electricity is, I think it's Pradeep, is there so that if this is some kind of card system or mobile system, whatever system it is, and I think Wally mentioned this, it's technology, so you need infrastructure to be able to run that technology. Similarly to why you need diagnostic tools and supply chain to ensure that the medicines are available and the tools and resources to advance sustainable healthcare are there. So quite the interesting dialogue. You'll hear more from this consortium as we think through how to move from phase 1 to phase 2 and get millions of individuals with primary healthcare, and the goal is to go from millions to billions.
Yeah. Thank you, Clifford. Millions to billions, and we will be in contact, with the representatives from JICA, Finland. Gerhard, I know will be calling upon you for that design of, as Wally was saying, those blended financing vehicles that would be deployed, along the platform. And also, I know JICA has really, partnered this and innovated it, along with Pradeep from UNAIDS and Osman, and also Africa CDC. Thank you, everyone. And we look forward to working with you on this endeavor.
Thank you.